I want to welcome you all to something to talk about today. And today we have Matthew Tabakin, who's a doctor who has been working on what I think is a very innovative new product designed to help us keep track of our meds, whether we're taking medicine on a regular basis or irregularly. It seems like this device would be really helpful for us to remind ourselves if we forget. And who hasn't said, "Oh darn, did I take my meds this morning?" So thank you, Matthew, for joining us. And why don't you just introduce yourself a little bit and talk about how you came to think about this as a product that you might like to work on.
Yeah, so thanks for the introduction. I appreciate you having me here for this conversation today. So I'm going to go ahead and share my screen. Oh, I don't think I can.
Oh, that's my fault. I can fix that. Advanced sharing offerings, all participants. Okay, that should be good. Does that help?
Yep, perfect. So I'm a doctor and the founder and CEO of Medsense Health. And what we do is we help people and families take and track medications using attachable Bluetooth sensors and a really easy to use mobile application. So a little bit of background for me, each year over 200,000 deaths and 23 million emergency department visits happen when people aren't taking their medications correctly. It's a big problem. And when I was in medical school, I spoke to lots of different types of people who are really struggling with this. And the turning point for me is one night when I was working in the emergency department, we had a guy come in with chest pain. We were performing CPR on him for all night. And had someone known he wasn't taking his blood pressure medications, he would still be here today. I had to go break the news to his family, and it was just extremely devastating for me. And it just felt like, this didn't need to happen, and there could be a solution, to really help people better keep track of their medications and keep track of their loved ones, their family members. So we came up with that solution. That solution's Medsense Health. So what we use is attachable Bluetooth sensors here that you can see on the left side of the screen. You can see on a pill bottle here, there's a sensor on top. So these attach to any medication container. So you have your prescription bottles here, your supplement bottles, eyedroppers, creams, insulin bottles, inhalers, and weekly pill organizers. Now we use a mobile app for setup, ongoing management and monitoring, but after it's set up, there's no mobile device required. And the reason for that is we actually use a hub here that you plug into in an outlet somewhere in your house, and that collects data from those sensors 24/7. And what's pretty interesting about our technology, you've heard about a lot in the news lately, is we're actually using machine learning AI to detect a valid dose from all these different containers. So what we've done is basically looked at the motion data from all these sensors and developed whether or not it was likely that that person was taking a medication at that time. We also use, you can see here that down here, there's a pink and yellow, orange, and let's say red up here. This makes it really easy to identify, which medication you're supposed to be taking and at which time. We really have a world-class device here that's highly technical, but also simple to use. Our batteries last for over 3 years. They're reusable. You can stick them onto a medication container, switch to a different one. And then again, they can send data to our hub over 100 feet through multiple walls.
So just one of the things that struck me was that although you do have to set this up, if I miss my medication, I don't have to check my phone. I might get a phone call. I might get an actual regular old phone call.
Yep, exactly. So during setup, you can actually choose how you want to be alerted and reminded. So you can choose whether you want a text message, a telephone call, and we even have an Alexa skill that I'll show you later. And then obviously you can use the mobile app as well. And what's really cool about using our sensors is if you take your medication on time, it'll actually deactivate that notification. So the system isn't bugging you unnecessarily. It could be there to just kind of help you out if you forget. So it's not saying 8 a.m. it's annoying you to, hey, take your medications, but at 8:45 if you forgot, it can prompt you to say, hey, you forgot, you should take this. And then once you do, it'll stop reminding you.
Matthew, is this subscription or how does one pay for this, and how much?
Yeah, so it's $85 is what we sell. I can get more into that later, but that's called, we have two different product offerings. It's called the Medsense Health Pack. I'll skip down here because from the questions. So here is our Medsense Health Pack. This is for 7 sensors that for any medication container. So prescription bottles, inhalers, eyedroppers, supplement bottles. And then we have a different package here, which is our pill organizer pack. So this is for if you're using a pill organizer. Now this comes with 7 sensors for each day of the week. So you see set Sunday, Monday, Tuesday, Wednesday, Thursday, etc. Now each one of these packages is $85. So here you can see
each one.
No, so each kit is $85. That comes with 7 sensors and one of those hubs.
No, I understand. So if you want both of them.
So we actually sell, so for the packages, this comes with 1 hub and 7 sensors. But if you wanted to mix and match, we have additional what we call just sensor packs. And that's just a pack of 7 sensors, and that's $30. So you would purchase 1 pack, and then if you wanted an additional pack, it'd be $30 extra. And then
so we'll get into some of this a little bit more, but I'd like to let you go through the sort of how the whole process works, so we get a sense of the product.
Yep. So after you get the package in, let's say, the mail and the person's home, the next step will be to plug in that hub, which you can see here, into an outlet. You will connect that to Wi-Fi. Once that's complete, you'll attach the sensors to the medication containers. So when you open the package, each sensor has just a double-sided adhesive sticker on the bottom. You simply remove that and stick it right onto your medication container. So you can see here is a yellow sensor on top. All you do is you just stick it right on top. What's really cool is that it doesn't come off. So then that's basically activated and turned into a smart device. Once that's complete, you'll customize alerts and notifications both for yourself, or you can use this for another person. So let's say you're caring for a friend, your neighbor, or let's say your parents. You can remotely set up and customize everything directly from your app. And then again, you can choose whether that person wants to receive alerts and notifications by telephone calls, text messages, or mobile app notifications. Now, if you're caring for someone else, you can make it so that that person receives, let's say, telephone calls, and you can be alerted about their medication consumption using text messages. So it's really a two-way street. And then after everything's set up, Medsense Health automatically will track medication usage and really help to alert and remind you based on how well you're doing, to help you keep on track and making sure you're doing a really good job taking your medications as prescribed. So here is a look at our mobile app here. Again, Medsense Health is a front-end medication management assistant for the user, and a back-end medication monitoring platform for the user, the family, and let's say your doctor or care team. On the left here, you can see all the different medications. This is how we track all that. And then you can view it graphically here. So in July, this person took their medications 100% of the time. And then we have also through our care portal, again, is how you would customize caring for someone else. So here in this screen, you can see how does Matt Tabakin 1 receive notifications? Again, app notifications, text messages, telephone calls, or even Alexa. Now, if you're a little bit more technically savvy, we also offer basically an Alexa skill, so you can do everything by voice. So this really allows you to interact with your medications. You can ask things like, "Hey, what medications do I take today? How much metformin do I take today? Did I already take it?" And then you also can ask questions about, if you're caring for someone else, say, "Hey, has my mom taken her medications yet?" Etc. So again, just to review, here are 2 packages. On the left here, we have our Medsense Health Pack, and then our right is our pill organizer pack. Each pack comes with, again, 7 sensors and 1 hub. This is for converting inhalers, eyedroppers, prescription bottles into smart devices. And on the right, it's for 1 pill organizer. Here's a look at basically what this looks like in the real world. Here are medication containers and supplements with our sensors on top. You can see orange here, red, yellow, and white. And then on our right here is a pill organizer, each with a sensor on top: Sunday, Monday, Tuesday, Wednesday, Thursday. So if you wanted to care for another person, we do charge a monthly fee for $20 per month. This is to completely remotely set up, manage, and monitor another one. So here you'd be getting alerts, notifications about whether they missed their doses, when they're taking their doses, and it allows you to really care for that person and make sure they're doing a really great job.
So is that a one-time fee plus this monthly fee? Is that how that works?
So
Or is
yeah,
it two
basic.
monthly fees?
So no. So basically, you can purchase the the Medsense Health pack for yourself for $85, or another person for $85, and then that monthly fee is basically to remotely manage someone in the future. So that's to get those notifications and check up on them and update their medication regimen, et cetera, all from the app. And we offer free 3 months when you purchase a Medsense Health pack and then want to upgrade to that subscription.
So you're now going to get to the kind of interesting fact of whether this works in the field, and you have some data.
Yep. So we've had some really exciting early results. We ran two 10-patient pilots that looked at the effectiveness of our platform, see how good it is in helping people, take the medications on time. We really looked at a wide range of age groups, all the way from 94 years old down to 25. And we showed that Medsense Health was able to allow people to take their medications 93% of the time. We effectively monitor medications from all 6 of these different medication containers. We increased medication awareness by 250%. So people really didn't know before, how well they were doing. And then with this platform, they really got a great idea on how they're doing. And on top of that, they were taking their medications, with extremely high rate. And then finally, we had a platform satisfaction rate of 96%. After setup, it's just really easy to use. It integrates directly into your life, and people thought it was just a great platform to help them take their medications on time.
Have you been talking with insurance companies to see if this might at some time be a benefit?
Yep, exactly. So we're currently talking to Blue Cross Blue Shield of Illinois, and then actually Aetna too, about initiating programs later this summer. We're running a pilot with a Medicare home health company out in Philadelphia right now. And then also in talks with several other both home health companies and then private in-home senior care companies.
So we have seen this year with COVID how much technology has been able to help us out. Many of us who weren't using Zoom are now using Zoom, connecting with families and friends. And I'm sure that some of the connections that we've established as well with our doctors, telehealth, et cetera, are going to continue post-pandemic. You're young enough that you probably have seen a lot of integration of technology into medicine. And maybe that's where this idea came from.
Yeah, so this past year, it's been pretty fascinating to see how much innovation has really been driven. Healthcare has always been traditionally known as kind of a slower mover and slower to adapt. And really, unfortunately, through this year, everything that, happened, I guess one positive was kind of the adoption of, telemedicine, remote monitoring. When I came up with this idea, it was about 3 years ago. And it had basically come from, I don't know if you've ever seen those tiles that you put on your keys. You can basically buzz them to.
Yes, my kid has one. My kid, I don't have one, but yeah, it's like, where did I leave my keys?
Yes. So I was like, well, one day I was kind of reading about medication adherence while I was studying in medical school. And then I was like, oh, what if we kind of just put these on our medication containers and use something similar to that? So that was really born from that idea. And then with everything that's been happening, the timing has been a good thing for us.
So have you had some mentors in this? Are there some folks that you reached out to that helped you kind of turn this into a business? I imagine when you went to medical school, you weren't thinking about being a chief executive officer.
Yeah, so actually I have one of Bainbridge Island's own, Mark Miller. He was a physician and also a physician executive. When he lives on Bainbridge. He's been extremely, helpful for me, kind of making that transition from a doctor into a businessman and helping me, think of ways to go to the market and also just help improve this product, making sure that we're always thinking about our customers and making it as easy as possible for people to use and helping people. We have a really great onboarding process where, when you sign up, we send lots of videos explaining how to use this technology. We also schedule appointments with people personally, one-on-one consultations to help them, learn how to use this technology. And once you get through that setup process, it's really, really easy to use. And that's been really important while having a technology product, before, especially targeting kind of an older population, can be a challenge. But by putting a lot of resources into that educational, aspects, you can find success.
What in your, Venera, I'll go to you in just a second. What have been the biggest challenges that you found, or modifications that you made as you started to roll this out to help make it easier to adopt?
Yeah, it's really just this is finding partners who are interested in working with you to initiate pilots. Work with healthcare sales. It usually takes about 12 to 18 months to implement any type of new program. Kind of related to just making sure all the security requirements are right, making sure all the legal stuff and innovating in healthcare can be a little bit risky. So it's just really finding key partners to demonstrate that this technology is effective and helps improve adherence has been a challenge, but it's one that through my background and mentors that I've met, that we've been able to start accomplishing that goal.
What is your background? Where did you go to school?
Yep. So I graduated from Medical College of Wisconsin with an MD, and then I was an economics major from Emory University in Atlanta, Georgia, prior to that.
And Venera, you had a question.
Oh, one of the things that I encounter in my old age is that I have a new product and I have to start learning new things about it.
Mm-hmm.
How difficult is this for the average Joe bloke like myself to get these buttons on the right spot and everything else? How easy is it to set up, I guess?
Yeah. So I could go through and show you a little bit about our app here. So everything we did, we try to make it like really, really simple. So this is our main screen here. We have medications here, data here, and notifications, and then care portal. So these are the only 4 buttons that you can press. So if you press medications here, you see a list of all your meds here. So then again, each color sensor correlates to this. And then when you go into add a medication, what you do is you pick what your container type here, and then it'll have a step after this. You'll go step by step to enter in the information. It basically asks you questions about it, and then the end of video pops up and shows you where to attach the sensor on your medication container. A little video, and then you press confirm, and then that's done. And then
Matthew,
when you go,
excuse me, can you cover entering a new medication? Do I call you and let you know that I've got a new medication? How does that communicate?
Yeah, so you would have to basically go in and add a medication, a new one after that. But we are currently working with what's called like an API, where you can integrate with electronic health records. So everything would be automatically integrated and updated. So if, let's say, a prescription was changed or a prescription was added, the app would automatically update to your current regimen. So we're working on making it even easier so you don't have to go in and change things.
But right now, when I go,
you do.
Yeah, right now when I go to my doctor, they ask me what medications, they review that. And so ideally what you're saying there is that their record would be matched with this app, so that when the doctor prescribes a new medication, it's going to show up. And then maybe there's a piece of it where I have to then add the sensor, but
Yep. And then once you add it though, there's nothing else to do. So a little bit of a setup process, but once that's complete, it's really, really easy to use. So here would be out here is notifications. So you just tap if you wanted to get a telephone call or a text message just by hitting this switch. So that's it, and then it's on.
And I could see that this would be something that either a caregiver or a home health aide or somebody like that could be authorized to do to help somebody for whom this might be still a little bit too complicated.
Exactly. And again, we do schedule personal consultations with members of our team to help people set up or answer any questions to really help them get get through the setup process if that's a challenge for them. We really like to engage with our customers and really help them get through that, because we know once they're through that setup process, it's a really great platform for them.
So you're based in Seattle, but
Yep.
you've been doing business where, across the U.S. at this point, or?
Yep, all across the United States. We've been having interest, East Coast, West Coast, Midwest, pretty broad at this point. All U.S. We haven't, thinking about maybe going into Canada, but once you kind of enter a new healthcare system, it gets pretty complicated. Again, you have to know all the regulations and things. So.
Yeah, and
Starting
even our lovely healthcare system in the United States is probably not the simplest thing to figure out.
I
Nope.
didn't know we had one. Nice to know.
Yep.
Well,
But they're doing a lot of good things in CMS and really pushing innovation lately. So they're doing a good job. I think moving forward, especially in Medicare Advantage type plans, where you should be seeing some new types of services, etc.
CMS stands for
Center of Medicaid Services, Medicare and Medicaid Services.
Oh, okay, right. The Medicaid program, right.
one more question, please, Matthew.
Mm-hmm.
I had an occasion. I take a shot in the belly for kitty and stuff like that. I encountered almost 2 weeks of not medicating myself because I didn't know the dropper had to go down to I kept waiting for it to go down to the bottom. And it was 2 weeks where I wasn't even, I don't know if I'm making that clear, but I'm not fooling when I say things get out of hand sometimes in our this thing.
Yeah.
Yeah, I think, and she mentions that an injection, insulin,
Yes.
for example, would be another example of that.
Yeah.
Does this cover that kind of thing?
Yep, we can have a sensor onto that as well. And then kind of to your example, which is great about using our platform, is you could share that data. So let's say to one of your family members or your doctor, and if you weren't, something happened, they should be alerted about that to kind of know that you weren't doing that for 2 weeks, and they should be able, making a phone call and checking it on to remedy that problem.
Yeah, it was after the fact though. They wondered why my numbers went hog wild crazy. So, but
Yeah.
I'm just entering some issues that do come up. And there are so many medications given to us sometimes.
Yep.
I mean, I have about 20, and that's crazy.
So
I'm alive, by God.
So another good thing would be to do is, I would say, even if you're using Medsense Health or another, even just a list of your medications, is to go in and just show your physician what medications you're taking, because they should be able to go in and eliminate duplicates and unnecessary medications. When you're older and you're taking tons of medications, we call that polypharmacy. And there's a lot of things you should be able to get rid of, or they can even make you have low blood pressure, fall, have an injury, and then you're in the hospital, and it's not great. So, using Medsense Health to have a list of all the medications you're taking, or even just by hand, bringing those to the doctor, showing them, is something I would recommend doing to help, make sure that you're taking the right meds and there's no interactions.
Well, that's terrific right there, because we don't know what interacts with something else and it causes another problem.
Exactly.
Thank you for that. That sounds good.
I want to make clear that this product is not endorsed by the Bainbridge Island Senior Community Center, but that it might be something that you would talk with your physician about as an option. And I just think that it's innovative use of technology and an example of some of the things we're seeing in our world today that is pretty amazing.